What's up, guys? Welcome to a little special episode of Barely Independent, which we would like to call Barely Explained. So basically, as you guys all know, the coronavirus is a big problem. Everyone's talking about it, but there's just so much misinformation that we need to figure out what this thing is, what's happening, so that we can actually make safe and informed decisions. So for that reason today, Tyron and I will be speaking to Professor Burtram Fielding. Professor Burtram Fielding, who happens to be the Director of Research Development at the University of the Western Cape, and he is also the Principal Investigator of the Molecular Biology and Virology Research Lab at the Department of Medical BioSciences, also at the University of the Western Cape. And it just so happens that he is also my dad, and a very nice guy at that. So, but like we don't accept information easily here. Why should we listen to you, Dad? Why?
So I think it's very important that, especially during times of disease outbreak, you need to get your information from reliable sources.
Of course.
So not everybody is an expert. Not every site has reliable information.
Okay.
So when you speak to somebody about the information, find out about the history, find out what have they worked on and what experience they have. So I first started working on coronaviruses, human coronaviruses in 2003.
That makes me black, yeah.
In Singapore.
Okay. In Singapore.
In Singapore.
Okay.
I always brag about Singapore.
Yes.
On the SARS coronavirus. Okay. So I've been pretty much working on human coronavirus for about 18 years.
Okay.
So I'm not a medical doctor. I have a PhD in microbiology. And everything I say about this coronavirus outbreak is based on experience of the years of research in the coronavirology field.
So, bottom line, you know what you're talking about. Like world renowned, they always like saying whenever they mention your name.
You was on TV.
You were on TV, you were on Chinese TV as well.
True.
And E-News.
And ENCA, yes.
The NCA.
Yeah.
And CakeNet.
And CakeNet.
Okay.
And now you finally get to be here on Barely Explained. So
This is obviously the best one.
the best one.
This is the
We heard it here, Professor Bertram Fielding.
This is the biggest one with the highest viewership
Yes,
possible. So
definitely.
Thank you for having me.
Okay, so before you hit on our podcast further, so just some context. We're here ultimately to discuss the outbreak of the COVID-19 virus. As of the latest WHO situation report available during the prep, there was 118,322 confirmed cases globally and 4,292 deaths. And then also there has been 17 confirmed cases in South Africa. So it's obviously a problem or an issue that affects everyone. It affects everyone globally. The WHO considering it a pandemic recently. But like the question is, and the question everyone I think is dying to ask is this it? Are we all going to die? And should we panic?
So this is not the zombie apocalypse yet.
Okay, it's not Zombieland.
No,
Okay.
not Zombieland yet. However, bad news. As of today, it's 130,000 infected
Okay, my
and
numbers
4,600 deaths.
Yes.
Okay.
The majority of those are still in China, and then very high numbers in Iran and in Italy at the moment.
Yes.
Is this the zombie apocalypse? Is this the end? Based on my experience in SARS and other coronavirus research, I do not think so. I think lots of the panic is due to what the WHO has called an infodemic.
Okay.
So
Can you explain what an infodemic is?
So not an epidemic or pandemic, but an infodemic. So it's an epidemic of information.
Okay.
Lots of information going all over the world because of social media.
Social media.
How do you separate correct, accurate information from not? And that's causing the confusion and that's causing the panic.
But the information's online there for us. So
Yes,
because information is so readily available, I can make my own conclusions about the thing.
Exactly.
And then because I might have a big social media platform, I relate that information to others.
Like on a WhatsApp group, and then that gets forwarded over and over.
And that's exactly the issue. So before you forward any information, go to the reputable sites, the USA CDC, NICD in South Africa, even the UWC website, the WHO. Verify the information on those websites before you share anything.
Okay.
Remember, in South Africa, the first person is being prosecuted for sharing fake news.
Yes.
Okay.
So there could be some repercussions.
Okay.
So
Don't share fake news.
yeah, be careful what you share as well if you do want to share. Share this. This is legit. So like the coronavirus and COVID-19, they've turned into a bit of buzzwords. let's make this a bit real for people. What is it? And like, why is it so scary as well? Like from the base level.
So, just extra information as well. So at the start, this was called COVID-19.
Okay.
COVID-19 is now the disease.
Okay.
And the virus is now called SARS coronavirus 2.
So it's SARS-2.
It's SARS-2.
Okay.
Why SARS-2? Because it causes severe acute respiratory syndrome.
Okay.
So the symptoms, it's a coronavirus, and it's the second one. So it's very similar to the one from 2003.
I was going to say, so you've worked on this before.
I worked on the
This
2003 one before. If you look at the genetic makeup, now remember genes is what determines your hair color, your eye color, your skin color, your height. Viruses have genes as well.
Okay.
So they have genetic material as well. If you compare the genetic material of these, of SARS-1 and SARS-2, they're similar about 90%, but that 10% is enough to make it cousins.
Okay.
Not the same virus.
Humans with 1% difference, like you get a whole bunch of different people.
So apparently human and bananas share 92% genetic makeup.
So 10% is a lot then.
And that's why you know so many bananas people. So be careful. So just get back to your answer. So what are coronaviruses? So before the 1960s, the only coronaviruses that researchers knew about were found in animals. So they were very important to farmers.
Okay.
Then in 1960s, 62, 65, people with cold-like symptoms came in, and 2 coronaviruses were identified from there. This was the first 2 human coronaviruses. Then we saw nothing.
Okay.
And in 2003, we saw SARS. SARS was the first one to kill.
Okay.
Then just shortly afterwards, we found another one that doesn't kill. And then we found MERS, which killed the Middle Eastern Respiratory Syndrome virus, which is very localized to the Middle East, Saudi Arabia, but it's also spread to 28 countries.
Okay.
Oh, wow.
It's killed 37% of those infected, but the good thing is it's only infected about 5,000 people.
Okay, and then the current kill rate then?
The current one only kills about, on average, 3.5%.
Okay.
So SARS killed 10% of those infected.
Okay.
MERS killed 37% infected.
But it wasn't that infectious.
It wasn't that infectious. The spread from human to human was very difficult.
Okay.
So the majority of cases were medical personnel treating, and then very strangely from camels to people.
Camels?
Really?
Camels.
So they spit in your face and then...
Well, I suppose it's
Remember,
Middle Eastern.
these are camel farmers.
Oh,
So they
okay.
were- so they were very
Makes sense,
close.
There's a lot of interaction.
That does make sense.
Exactly.
Speaking of, can I just make a comment? How much can you speak into of where this thing came about? Where did it start? Because there's a lot of stories out there. What are the facts? What are the reliable and legitimate facts of where this thing came about?
I guarantee you now, you go look at African bats, and you look at Asian bats, and you look at the type of viruses you find in them. You'll find hundreds.
Okay.
So SARS, MERS, and SARS-2 all have been traced back to bats,
Okay.
and probably Asian bats.
Yeah, those vampire bats or just like normal...
So these are more fruit-type bats, and
So it's people eating bats then?
not yet.
Not yet.
So what happens? So you have these things co-evolving with bats.
Okay.
So the bats, even though they're infected, they never become ill. So
Okay.
they're asymptomatic carriers, no symptoms,
Okay.
but they have the virus. They're in contact with other animals. So the theory is for MERS, the bat was in contact with camels.
Okay.
So probably some poop onto the
Yes.
animal feed.
Yeah.
Camels became infected, humans became infected. For SARS, bats, civet cats, which is like a ferret,
And it's a delicacy in China.
it's a delicacy in China,
they eat
Oh,
to
everything.
humans.
Okay.
This one, the theory is bats, either snakes or pangolins, they're not sure yet, researchers are not sure, then into humans.
Okay.
So bats have always been this reservoir
okay.
where
Of
where the virus then changes, so it mutates, or it mixes with another virus,
Okay.
and when it hits, and it's all random. So the mutation or this mixing with another virus could lead to this new virus that somehow now recognizes what is called receptors on the human cells,
Okay.
and then can get into the human.
So it's almost like a lock and key into certain cells.
It's nearly like a lock and key.
Okay.
And then, so it's actually good that we're talking about this. This specific one, we've spoken about its animal origin, but how is it spread amongst people? And who's also the most vulnerable when it is spread?
So current data shows that it spreads exactly like other respiratory diseases. And what is the most well-known one? Flu.
Flu.
Okay.
How is flu spread? Droplets.
Yes.
Coughing, sneezing.
Coughing, sneezing, so it
close
gets
to
into your
someone.
droplets, and then it moves through the air,
Yeah.
could land on surfaces. And I just saw a paper today, it's not published yet. Apparently it can stay active on surfaces for 3 hours.
Okay.
That's a long time.
So SARS can stay on surfaces between 24 and 36 hours.
Okay.
Oh, so we're still
Other
very early
viruses,
into this.
other viruses could stay on surfaces for 2, 3 days, 4 days.
Oh, wow.
So what happens? You come along, somebody sneezed into the hands, touch their surface. You touch that surface, you touch your nose, your mouth, or your eyes, gets into your body.
Is this why hand sanitizing the whole time?
Exactly.
Staying hygienic.
Clean your
Does
surfaces.
hand sanitizer like that you can buy in the store actually help?
Anything with alcohol, about 60% alcohol would work.
Okay.
But also, fairly effectively, just normal soap and proper hand washing.
Again,
Okay.
that's like, like sing
Is
the
that
happy
just-
birthday song twice.
Yeah, I heard so.
Between the fingers
Is that just because the hands are the most common way that these things are
and this is, we touch on average our face 30 times a day.
How many times have you touched your face when we started recording?
Sure, I picked my nose, I think.
Exactly, and you shook my hand when I came in.
I just touched
Yes.
my face
So,
now.
so if I was infected with any respiratory,
Yes.
then you would have transferred it to your face.
Already.
If I sneeze, remember the cloud
Yeah.
of snot still hangs.
It envelops
It still
everyone.
hangs. So you walk through it.
So how do we sneeze? Is it the entry?
You need to sneeze and cough into there,
Okay.
preferably into a tissue.
But then you should be washing here because
You
it's
can't walk around with this all day.
Okay. You
So
need to go
preferably tissue.
Okay.
Okay.
Do not touch your face.
And then with how it's spread, who do we know as the most vulnerable right now?
So strangely at the moment, as with SARS, it appears as the older males.
Okay.
So above,
no.
no, much older males.
Okay, much
not
older.
this older.
65
Okay.
and above.
So it looks 65, 75. The highest death rate is 80 and above.
Okay.
There's almost no infection and virtually no death rate in everybody under 25, under 30.
Oh wow.
Oh, wait, you... Oh,
No, I'm 27.
So you still safe for now.
3 more years. Yeah.
But remember, as soon as you get married, then it adds 4 years to your life.
31.
So it seems as though the most vulnerable are the elderly and interesting males.
Okay.
So the WHO is now speculating why males. Remember, the majority of cases are from China.
Yes.
So our data is based on Chinese data.
Oh, and
okay.
their population is skewed.
But
to more
also
males.
what? So there's more males, but also what? Males in China, almost all of them smoke.
Oh wow.
So they are predisposed to have
So
lung
it's-
diseases. Exactly.
And even those who don't because of air quality.
Exactly.
So I want to say, just to comment on the stat you just brought
Yeah.
up. So most of them who are infected and that the cases are serious are already old, and of those already old people, do some of them have previous health conditions that
So
are
it's,
already?
so it's called comorbidities, which means they have other diseases, and the predominant one is lung disease.
Okay.
Lung disease, high blood pressure, heart disease, diabetes. Those are the 4 or 5 big ones.
And so of the 4,500 deaths, we're probably finding the majority of them fit.
Yes.
Maybe 90% of them fit into that category.
But also remember, if we're saying that, say worst case scenario, 4% died,
Okay.
it means that 96% are not dying.
Okay.
So
Recovering.
recovering? So
Yeah.
they're either on their way or they have recovered.
Okay.
So why the panic?
Yeah.
That's the whole.
So like looking at the big picture, there's really no need for panic. Like, yes, loss of lives is terrible, but that there is no need to panic because it's mostly recoverable. Always a fact that people like throwing around, I like throwing around, the flu kills more people per year than this has killed so far.
So if you look at average, the flu of the past 3 years in South Africa alone has killed 110,000 people.
Oh, wow.
Okay.
That's terribly high.
Exactly. So we have, I think last figures I saw, 110,000 severe cases on average of influenza in South Africa per year.
Yeah.
This is not even close. We don't
Yeah.
even have these figures worldwide, really.
Only 17 confirmed cases of this as well.
And the majority of those were traveling.
Yes.
We do have our first non-traceable one now.
Okay.
But the WHO yesterday declared this a pandemic.
Okay. So now on that point,
What does that mean?
mean?
So a pandemic and an epidemic
Yeah.
is essentially the same thing.
Okay.
Epidemic, you have huge number of diseases in a particular location
Okay.
where you would not expect to see this disease before.
Okay.
As soon as it spreads to other countries and to other continents, and you now have internal spread. You have epidemics,
Okay.
various countries, and various continents. It's called a pandemic.
Okay.
So a pandemic is essentially epidemics in various places at the same time,
Okay.
so it can now spread differently. You don't have to travel to Italy to get it anymore now.
No.
Somebody here could be infected, you could pick it up from them.
Yeah.
So it is not a reflection on the severity of the disease. Because, no. So people here, we are at an epidemic and now it's a pandemic. Then, buy the toilet paper. That's not severity.
So we shouldn't go out and go buy toilet paper.
So coronavirus, today's coronavirus, is not a case of severity, it's a case of infectability.
So what I'm saying is pandemic is not a reflection on the severity of this.
Okay.
It's on the location of it, the spread of it.
Okay. But the word makes people freak out.
Yes.
Because it sounds a level up from epidemic.
Yeah.
Oh, yes. We were at epidemic. Now we're at pandemic. And everyone's
Exactly.
freaking out. Okay.
Yeah,
So it just means that it's in other locations at the moment, and spread is slightly different.
So then with the whole idea of locations in mind, us as South Africa, are we ready to face this? I know there's a whole bunch of expats from the Wuhan province that's coming back to South Africa. Are we ready to deal with them? And also, are we ready to deal with the cases that we might find here?
No, so look, especially with the WHO redefining this is a pandemic now. So you could see internal spread as well now, from person to person without any travel history. So it's becoming a bit more complex now. So everybody that has symptoms will not be tested. So self-quarantine is very important.
Okay.
So it means you need to go somewhere and isolate yourself for 14 days.
Okay.
And this isn't some place you can touch things and send it out so that people get infected.
So you need to essentially lock yourself in your room and not be in contact with others.
Okay. Karen, quarantine tips, eh?
So that is
my wife's a teacher.
That is so imagine.
If I get it, then
and she gets it, and you take her to school. But remember, kids, especially 2 to 4 year olds, I've not seen any numbers of them being infected yet.
Okay.
People are dying by the hundreds in Iran
Yeah.
on particular days. I spoke to somebody on the WhatsApp group. I'm part of a bigger group.
Yeah.
The guy from Iran said, we have not seen any kids infected.
Wow. Okay. Yeah, no,
So
that's good to hear.
there's something that we don't understand. And we've seen it with SARS as well. In Singapore 2003, Ezra was in school there. They shut school for a month. And then we realized, this is nonsensical. It doesn't help because they're not getting it.
So it's really highly unlikely that your young
Very
school
unlikely.
Kids, okay.
No, that's good to
So
hear.
schools don't have to panic.
Schools do not have to panic. And when I say do not panic, schools do not panic, people do not panic. I'm not saying do not be vigilant.
Yes.
Okay.
I'm saying do not panic because there is no use of panicking. We're moving into winter now.
Okay.
If you come down with flu, the symptoms are very similar.
You're gonna think.
How do you differentiate between? You can't.
Yeah.
So you need to be tested, but they're not going to test everybody.
Yeah.
So if you can, get the flu shot,
Okay.
because then it prevents you from getting the flu, which takes that out of the equation.
Okay.
So just one more question along this line, and then I want to just get to some practical things that we can do. But why does it take so long, and why is it taking so long to find a cure of some sorts? Or is a cure even possible?
So remember, to develop an antiviral, to develop a drug, takes between 0 and 10 years.
That's a long time.
It is $1 billion to take a drug from start all the way through. Here we're saying that we should develop something in 6 months. So the quickest I've seen now, there are estimates that we'll have one in 6 months. They said April next year, which is not quite 6 months.
No, it's about.
It's a bit more, yeah.
So that is sidestepping all of the best practices.
Okay.
Yeah.
That is rushing something through. I've seen studies today, somebody shared with me today from the States, that there are drugs being used in China that was effective against other viruses that appears to be effective against these.
Okay.
That needs to be proven in other countries as well.
Okay.
Yeah.
Remember, so we're going to try all the known drugs. Remember, antibiotics cannot work against the virus.
Yeah, because it's only bacteria.
It's only bacteria. So you need to test antivirals, and then they've tested things like anti-malarial drugs. They've tested antivirals for flu.
ARVs.
So they're testing all of these, and if something appears to be working, they will rush it through.
Okay.
Vaccines, since we can grow the virus in the lab,
Yeah.
and we know what the genetic makeup is, vaccines are being sped up,
Okay.
but how safe are they? Because remember, they spread. So it needs to be tested and vetted.
Yeah.
So the minimum is probably about a year and a
Okay.
bit to make sure that what you get out
So
is not contaminated.
So the question is in a year's time, will this coronavirus really have been this worldwide killer, such that such steps need to be taken? Now, what I mean is, are we going to see millions of deaths in the next year?
two things are going to happen. Based on my experience, I'm not a medical doctor, but based on SARS and based on MERS, I'm seeing two things happening. This thing is either going to die out of the population, not the population dying, the virus dying out of the population.
No, that's good, yeah.
Probably middle of the year, just slightly after, which is now slightly less likely based on what I've seen in the data, or it's going to become the circulating coronavirus.
So like the flu almost.
No, remember, so flu does, but remember flu changes every year. The virus changes every year. So I've said earlier, we have 7 human coronaviruses, 3 are deadly, 4 circulate throughout the human population consistently.
So we might have had one of the coronaviruses.
We definitely have had it.
While we're making such a...
So we've tested, because this one is killing.
Okay.
So we've tested students on campuses. At any one point, 15% of students are infected. Because it causes mild cold-like symptoms. So one of two things, it either dies out of the human population or it's going to become a circulating one. Why do I say it could become a circulating one? Remember swine flu about, 3-4 years ago? Everybody panicked.
Everyone panicked.
At the moment, swine flu is the predominant circulating influenza going around.
And nobody's
panicking.
Because it's not killing anyone.
Remember, so people still die. But remember, anything new comes into the population. None of us have been exposed to it. We do not have the natural protection against it.
So it's like the Aztecs and smallpox. Spanish come and all of them die.
Spanish are all resistant. They come in. These people have no resistance. All of them die. What happens if you've been exposed to it? We build up resistance. So in a year's time, we'll probably have resistance.
That's good news.
So
unless it mutates.
Then we have an issue. But then, so now that we've established there's no need to panic and everything, what could we do practically? So what I want to cover specifically is what can schools do, what can universities do, and what can workplaces do? And then after that, we can maybe touch on just things that we can personally keep up with. So like, what can we do?
So the bad news, we can't do much. I think at one point, I saw figures where the researchers speculated at one point 70% of us would have been exposed to it. So it will spread. I do not think it will be as deadly as what people think it is. With any disease, like you said, it's always tragic, any life loss. With any disease, you will have those who are more at risk, so some of them will die. So it is, how do we control flu? We will do exactly the same. Yes, if you want to minimize, at the moment, if you tested positive or you have symptoms, they isolate you for 2 weeks. Can you afford to not go to work for 2 weeks? So from that perspective, I understand what companies and schools and universities are doing. So they're very much about protecting the business, which is understandable. Economy is important. So it is, if your staff can work remotely, have them work remotely. As soon as anybody comes down with symptoms, have them self-isolate and have them tested. Tygerberg would determine whether they need testing or not, based on certain criteria, tick boxes. So isolate, do not have them come to work and have them work remotely. Some universities have banned all international non-essential travel. Because we have Skype, we have Zoom. You can have meetings. So you could do that.
What about biometric systems at universities?
So some universities have stopped those.
No, it was UP.
I think it was UP. UP stopped those. Because obviously there is a risk. So, those type of measures, ask yourself the question, what would I have done to prevent the spread of influenza, of flu? Exactly the same. You would do exactly the same. Same type of measures.
So pretty much we need to treat it, I'm by no means degrading it, as a very bad flu. We're going to wash our hands, make sure that we cover up when we cough and when we sneeze, and also just not go around touching everything and then touching our faces.
So I always have a problem when somebody says, because I've seen medical doctors and very good researchers saying it's nothing but a very bad flu. The problem with that is people then equate the two as the same thing.
They want to go out,
so they're two totally different things. They're from totally different families. So the symptoms are very similar, and it is more severe symptoms. You could see in this one, but you see very severe symptoms in the elderly as well. You see with influenza, unfortunately, smaller kids, you see very severe symptoms. So there's another huge difference. Influenza, small children, this thing not. So yes, you're right. Treated as a very severe flu, but keep in mind, that it's not the same thing. It's two vastly different things. So if you get a flu shot, it will protect you against this one, the flu, not the other one.
Yeah.
Okay.
So the idea is it stops this one from coming, so that if you get something, it probably could be this one. But remember, there are many, many other viruses that could also cause flu-like symptoms.
But now, I want to just ask a question. If you do think you might have it, or you've got symptoms that kind of mimic it, is there no way that you don't have to go to hospital and infect everyone else?
You could self-isolate.
Okay.
Which
That's safe because you're not maybe being medicated or treated.
Remember, there is no medication for this.
Okay.
Yeah.
So you really go in for treatment when you have breathing difficulties, because in the severe cases, you have the lungs affected. I saw today that kidneys are affected and liver is affected. So you will know, I need a medical doctor at this point in time.
Okay.
If you can't breathe and you're still laying in bed thinking that it's going to pass,
No, you need to go.
then you need a club.
Yeah.
So you will know. So self-quarantine, so self-isolation, but that means that you do not go out. Your family in your home, they need to be separated from you, so you need to wear a mask, you need to sterilize the surfaces. If you self-quarantine, however, and you have symptoms, please, you need to contact either the NICD, the National Institute of Communicable Diseases, South Africa, or you call Tygerberg.
Yes, the quarantine unit.
They will so they would not even quarantine you there unless you're positive. But both of those, you'll go to a call center, they will ask you specific questions.
Okay, that's great.
And it's tick boxes. And if you have those tick boxes ticked, they will tell you, can you please come in, put on a mask, don't get into contact with anybody. You come in, we need to test you. If you're positive, they'll quarantine you. It takes about 2 to 3 days to get the result.
So it's still quite a while. And could it have passed even by then? Or
if you've been in contact with others, yes. Remember, you have the potential to infect 2 others. You do get super spreaders who can infect a whole lot of people. But super spreaders are far in between, so they're not very common.
Cool. So that's about all the time I have for today. Thank you so much for coming in. Ladies and gentlemen, Professor Burtram Fielding, my dad. Thank you so much. I hope this has been helpful. We're going to post links to the WHO, the NICD, all useful links. In the description below if you guys have more questions. And then also maybe have more questions, maybe hit us up on Twitter or also in the comment section below, and then we can see what we can do. So thanks so much for tuning in, and I hope this was helpful. And stay safe, wash your hands, and read some books. Okay, thanks. Bye.